So, the welfare topic that interests me the most right now is one that is discussed both in the book and is pretty big in current events right now, and that is healthcare. I take a more liberal view on most issues. Okay, yeah, I actually take a very liberal view on just about any issue, especially recently. On the issue of healthcare, I prefer government programs over private for multiple reasons. One being that history has shown that when huge problems hit our economy, such as the Great Depression, private charities cannot keep up with all of the demands that are necessary to help out the population, so the government is forced to intervene if they haven't already. There is a continuing growth in societal standards of health, nutrition, and security, and government welfare programs are really the only sufficient way to keep with this increasing trend. So, why do some people feel that it's fair that if you're rich or at least wealthier than most people, that you can have access to private health care, but if you're poor, then you don't deserve it or you don't have the right to it? Also, just because citizens do not have the means to pay for it, expensive private health care that it's adequate for their family does not mean that they don't deserve it. The social worker plays a role in healthcare that many people might not consider. A healthcare social worker provides psychological support, education, counseling, advising, and many other services to groups, families, and individuals. Specifically, social workers act as mediators, counselors, and patient advocates. They even have a hand in planning health services for their clients and developing health policy. As a mediator, social workers help clients deal with the complex and problematic health system to obtain the necessary services from the healthcare institutions. From a counseling standpoint, social workers help people that are dealing with health issues and illnesses. So, emotionally unstable clients might receive help from a social worker when their family or personal problems interfere with their treatment plans, or when clients need help with financial troubles or planning discharge from a hospital. Working within the hospital or health system in recent times, social workers ensure that their discharge of a patient or transition to another institution is carried out without any problems. They also monitor the services that are offered and decide which services are essential to patient recovery to ensure that the best possible care of patients. Finally, social workers act as advocates for their clients and patients. They are involved in aspects from assisting parents in staying with their sick children at the hospital, being involved with policy and planning committees, and contributing during complex ethical dilemmas, such as maybe terminating a problematic pregnancy or discharging an elderly patient back into a questionable nursing home. They take part in lobbying for more affordable and equitable healthcare system that would work for everyone. And this is crucial to maintaining a healthy and happy social economic environment.